Imagine waking up one morning and feeling like you've swallowed glass. Every time you try to speak or swallow, it's like razor blades scraping your throat. That's not a scene from a medical drama. It's a real symptom people are reporting with a new COVID subvariant sweeping through California. It's being called razor blade throat, and it's making headlines not just because of how it feels, but how fast it's spreading. This new subvariant, nicknamed Nimbus, is a close cousin of the Omicron family. First detected overseas, it has quickly gained traction in the United States. In just a matter of weeks, it went from being barely detectable to becoming one of the most dominant strains in the country. In California, it now accounts for over half of the new infections, and that number is still climbing. What makes Nimbus different? Well, many earlier COVID strains brought symptoms like coughing, fever, or loss of taste and smell. This one comes with a burning, painful sore throat that people say feels like tiny cuts every time they swallow. Some describe it as the worst sore throat they've ever experienced. And it's not just one or two people. Clinics and emergency rooms are hearing this same description again and again. Public health experts say the spread of this subvariant is being closely watched. Wastewater samples from several parts of California show a clear uptick in COVID activity, especially in southern regions. Test positivity rates have also been rising, signaling that more people are getting infected, even as most cases remain mild or moderate. Thankfully, there's no sign, so far, that Nimbus causes more severe illness than previous variants, but that doesn't mean it should be ignored. Health officials are reminding people that COVID is still very much active, and even a mild case can bring days of intense discomfort and disrupt your life. The good news is that the current COVID vaccine appears to provide protection against Nimbus. Doctors are urging people, especially those traveling or spending time in large gatherings, to stay up to date on their shots. Simple steps like wearing a mask in crowded places or avoiding close contact when you're sick can still make a difference, especially for vulnerable groups like the elderly or those with weakened immune systems. While we're no longer in the early crisis stage of the pandemic, the virus continues to evolve. Nimbus and its razor blade throat symptom are just the latest example of how COVID keeps finding new ways to affect us. Staying alert, staying informed, and taking preventive steps remain our best defense. So if you feel that telltale burn in your throat, don't panic, but don't ignore it either. It might just be a summer cold, or it could be the cutting edge of the next COVID wave.